Hello, this is Dr. Moffitt, and this is an installment of our Facebook Live series. Tonight I wanted to talk about gentle IVF. There's been a lot of excitement about gentle IVF, and there's been a little bit of confusion about it, so I thought I'd just spend some time talking about what it is and maybe what it isn't, and going over some of the details about it. So basically at ARMS we have two main types of IVF treatment. One is called optimal IVF and the other is called gentle IVF. Optimal IVF, the reason why we call it that is because clearly in the vast majority of cases the optimal way to do IVF is to do optimal IVF. And what that means is we're going to give you as much medication as we feel is necessary to get as many eggs as we possibly can. IVF is most successful when we get lots of good quality eggs, and so we give medications in order to stimulate the ovary to make as many eggs as we safely can. And so the way we do optimal IVF is we give this fair amount of medication. Because we're giving a fair amount of medication, we need to monitor you closely to make sure we're doing that right. We're not giving you too much, we're not giving you too little. And so there are several visits that go along with that. So for example, in an optimal IVF cycle, you may be on medications for 10 to 12 days. And during that time you'll have 4 to 6 monitoring visits, maybe even more, depending on how complicated your stimulation might be. And so when that's basically what optimal IVF is. And the cost of that, it's all on our webpage. You can just go to our pricing and it'll list that. What most people choose is a non-refundable plan, which is $8,900 plus the cost of the medications. And also we have many different ways to help people do that if they don't have insurance and are paying self-pay. We have discount plans, we have financial aid plans, we have payment plans, and those all can be accessed on our website. Sometimes, however, the cost is just prohibited, and the option is do nothing at all or do another treatment which really isn't as beneficial as doing an IVF cycle. So if you're in that situation, we have what's called gentle IVF. And what gentle IVF is we're going to give a fixed amount of medication, which in the vast majority of the cases is sufficient enough to get a reasonable number of eggs. But we aren't sure that we're giving the maximum amount of medicine that we need to. So we have a fixed amount of medication that we really aren't going to modify very much, and we're going to give it to you. Because we are doing this modest fixed amount of medication, we don't need to monitor you as much. So we have actually found that we only need to monitor you maybe 2 or 3 times during that period of time. Because of that, we're able to do this for a much lower cost, and because we're doing a fixed amount of medication, the cost is less. And so on our website you'll see that the cost of a gentle IVF cycle is $4,800 plus the cost of the medication. The medication usually comes in around $1,500, which is significantly less than an IVF cycle. At optimal IVF cycle, your medications can range from $2,500 to $4,500 in medication costs. There are a couple of other things that we do in our IVF cycles to make them more gentle on the body. One of the things is the regimen allows us to give fewer injections. Some clinics will give up to 5 injections a day. We can do that with only 1 injection a day, and we have methods to help people do that. So you only take 1 injection a day. Again, the visits are much, much less. The ovary gets stimulated less, so that's a little more gentle on the body. But I don't think that's a major issue because IVF nowadays is very safe, and so we don't think that optimal IVF is less safe in any way. So the main advantages of a gentle IVF cycle are mainly pricing. It allows people who can't access an optimal IVF cycle to be able to do something. Again, an optimal IVF cycle is always best because we will probably get more eggs, and because we'll get more eggs, we'll be able to create more embryos, and if you have more embryos, then we're able to select the best from many, and that gives you a better chance of success with your first transfer. In addition, because you're going to have additional embryos left over, you're going to have more chances to try. And because you have more chances to try, you're going to have a greater chance, a greater cumulative chance of getting pregnant. However, studies show that with protocols like gentle IVF, you're going to get on average 10 eggs, so you're still going to do very well. In patients of ours who have a normal AMH, we've actually been getting on average about 20 eggs. So this protocol is by no means equivalent to what is sometimes called mini IVF. Mini IVF, those types of protocols typically will only give you maybe 5 or 6 eggs. And there's a simple analysis that can be done to say, well, how many eggs does somebody really need to get in order to have the optimal chance of having a pregnancy? And 10 eggs gives a very good chance of having one normal blastocyst to transfer, actually 2 normal blastocysts to transfer, to then give you the greatest chance of having that live birth. So gentle IVF is a much better approach than probably a mini IVF. Anyway, I hope that clarifies the difference between optimal IVF and gentle IVF, and have a great evening. Bye-bye.